Imagine stepping into your retirement years and the worry of running out of money is nowhere to be found. Instead, you have the security of knowing you'll receive a steady stream of income and healthcare coverage, no matter what. Sounds like a dream, right? But this is exactly what Social Security and Medicare aim to provide for you as you age. So let's break it down, and I'll show you how you can take full advantage of these programs. Before we jump in though, make sure to hit that subscribe button. We're so close to 1,000 subscribers, and I'd love to have your support as I continue to bring you useful insights on retirement and personal finance. What is Social Security and why does it matter? Let's start by discussing Social Security, one of the most important pillars of the U.S. retirement system. Social Security was established in 1935 as a safety net for older Americans and is funded through payroll taxes paid by workers and their employers. This program provides monthly income to retirees, people with disabilities, and survivors of deceased workers. Each of us contributes to the Social Security Trust Fund through our payroll taxes, and when you retire, you'll begin drawing from that fund to help replace your income. However, Social Security is not intended to replace your entire paycheck, but rather to supplement it, typically covering about 40% of your pre-retirement income. How Social Security works. When you work, you pay into Social Security via payroll taxes, and after you've worked a certain number of years, usually 10 years or more, you become eligible to claim benefits. The more you earn throughout your working life, the higher your Social Security benefits will be when you retire. The program is designed to give you a regular check that you can count on during your retirement years. However, the amount you'll receive depends on how much you've earned over your lifetime, your full retirement age, and when you choose to start claiming benefits. Most people start claiming their benefits at age 62, which is the earliest eligibility age. But waiting until your full retirement age, FRA, which ranges between 66 and 67 depending on your birth year, will give you your full benefit. Delaying even further, up until age 70, can increase your monthly payment due to delayed retirement credits. How to maximize your Social Security benefits. To maximize your Social Security benefits, it's crucial to understand the calculation method used by the Social Security Administration, SSA. They consider your top 35 years of earnings, so working longer and earning more can significantly impact the size of your monthly benefit. On the other hand, if you have years of low earnings or gaps in employment, your benefits will reflect that. If you're married, your spouse's work history can also affect your benefits. You might qualify for a spousal benefit, which allows you to collect a portion of your spouse's Social Security benefits if they're higher than your own. In certain situations, you can also claim survivor benefits if your spouse passes away. Social Security and taxes. Something often overlooked is the taxability of Social Security benefits. Depending on your income in retirement, you might be required to pay taxes on your Social Security benefits. If your combined income, including half of your Social Security benefits, exceeds a certain threshold, up to 85% of your Social Security benefits could be taxable. This is an important factor to consider when planning for retirement because it can affect how much money you'll actually receive. The good news is that for many retirees, Social Security benefits are not taxed, especially if you have other sources of income like pensions or savings that are modest. What is Medicare and why is it important? Now let's move on to Medicare, which is equally important to your retirement security as Social Security. Medicare is the federal health insurance program that provides coverage to people age 65 and older, and it helps reduce the financial burden of healthcare as you age. With healthcare costs increasing year after year, Medicare provides invaluable assistance to retirees who would otherwise struggle to cover their medical expenses. Medicare is divided into different parts, each designed to cover different aspects of healthcare. Part A covers hospital insurance. This helps pay for inpatient hospital stays, skilled nursing facility care, hospice care, and some home health services. Part B covers medical insurance. This pays for outpatient care, doctor's visits, and some preventive services such as screenings and vaccinations. Part D is for prescription drug coverage, helping to pay for medications you might need in retirement. How to qualify for Medicare. If you're 65 or older, you are eligible for Medicare. For most people, Medicare Part A is free because it's funded by the payroll taxes you've already paid during your working years. However, Medicare Part B and Part D require monthly premiums. The premiums for Part B are based on your income, so higher earners will pay higher premiums. If you're already receiving Social Security when you turn 65, you'll be automatically enrolled in Part A and Part B. If you're not receiving Social Security, you'll need to manually sign up for Medicare during the initial enrollment period, which starts 3 months before you turn 65. Medicare Advantage and supplemental insurance. While Medicare provides essential coverage, it doesn't cover everything. For example, it doesn't cover dental, vision, or long-term care. That's where Medicare Advantage, Part C, and Medicare Supplement Insurance, Medigap, come in. Medicare Advantage plans are offered by private insurance companies and provide an alternative to original Medicare, Parts A and B. These plans often include additional benefits like dental, vision, and hearing coverage. On the other hand, Medigap plans can help cover the gaps in original Medicare by paying for things like deductibles, coinsurance, and copayments. How Social Security and Medicare work together. Social Security and Medicare are often used in tandem to provide a comprehensive safety net for retirees. Social Security provides the income you need to live comfortably, while Medicare helps with healthcare costs, which can be a major financial burden in retirement. By understanding how both programs work and how to maximize your benefits, you can ensure a more secure retirement. The future of Social Security and Medicare. It's essential to keep in mind that Social Security and Medicare face challenges. As the baby boomer generation continues to age, more and more people are relying on these programs, which puts a strain on the funding. For example, the Social Security Trust Fund is projected to run out of money by the early 2030s, and Medicare is also facing funding challenges. While it's unlikely that these programs will disappear, there could be changes to the way they're structured in the future. For example, benefits might be reduced or the eligibility age might rise. So it's important to stay informed and plan accordingly by saving and investing for your future beyond Social Security and Medicare. Final thoughts on Social Security and Medicare. Social Security and Medicare are two of the most vital programs available to retirees in the U.S. They provide a financial foundation and access to healthcare during retirement, but they're not a complete solution on their own. It's essential to have a plan for additional savings and investments that can supplement what you receive from these programs. In the end, Social Security and Medicare can help secure a more comfortable and less stressful retirement, but it's crucial to understand how to maximize these benefits and to plan ahead for additional income sources and healthcare costs.